Raise your hand if you've been to the emergency room maybe more than once, and why? Because you thought you were having a heart attack. Your heart was palpitating out of your chest, you had pressure, shortness of breath, and of course, off to the ER you went, often in the middle of the night, and only to be told your heart was fine. And perhaps you were not convinced because you continued to have these heart palpitations, and they are very stressful. Anybody would freak out when their heart is just beating out of their chest, especially when you have the tightness and the pressure. And you go to a cardiologist and you get a battery of tests, and they do an EKG and a stress EKG and more, only to be told your heart's fine. And if you follow me at all on this channel, when I talk about hiatal hernia syndrome, I'm very quick to point out that it is related, and the fact that there is nothing wrong with your heart as far as any disease state or functional aspect of it, sure, that's great news, but it does not negate the fact that you're having heart palpitations, pressure in your chest, etc. So raise your hand if this has been you. I was pretty delighted to stumble across a cardiologist. He is in the United Kingdom. He's not here in the US, but I think he should do a seminar on what I heard him talk about. And he talked, I don't know if he created this terminology, but he called it a gastric cardio syndrome. So gastrocardiac syndrome. And so I saw that, I was like, I wonder what he's going to talk about. And sure enough, he talked about the fact that anatomically, and I say this all the time, we have the heart on the left, we have the stomach just below it on the left, and in between is the diaphragm. And he discussed the fact that the anatomy of these two organs is very close in proximity, and sure enough, brought up the fact that with bloating, with inflammation, the diaphragm rises, and he actually called it pinching the heart and altering its location a bit. And so it was just gratifying to hear somebody who is a cardiac surgeon, and this is what he does for a living, acknowledge what we've known for so long, and what no cardiologist, and I shouldn't say no, but in my experience of doing this for quite some time, I have not heard any patients have their cardiologist acknowledge what was going on, and the fact that they had a lot of GI complaints or a known hiatal hernia. No cardiologist has acknowledged that those two could be related. Quite the contrary, they say no, it couldn't possibly have anything to do with your heart. So this cardiologist, again from the UK, his name is Sanjay Gupta, and he talked about a few things. So he talked about the anatomy, of course, which we know, and the fact that the impingement of the heart, because the diaphragm is elevated, can create heart palpitations. I was like, oh, I was so excited. And then he also talked about another part of our program, which is the vagus nerve. So it's the longest cranial nerve you have, and it goes to a lot of different organs, but it goes to your heart and it goes to your stomach. And he mentioned that if the vagus nerve was overly stimulated, irritated, sure enough, if it's affecting the stomach, it can affect the heart, and vice versa. He also mentioned, and this was something that I hadn't emphasized in the past, so I want to bring it up, is that the vagus nerve actually is responsible for slowing the heart and making sure the heart doesn't get too rapid in its beat. But, you know, there's always that Goldilocks perfect arena or area of function, so too little is not good, too much is not good. So if due to hiatal hernia or something else that's causing the vagus nerve to be irritated, then the heart rate can go too low. And he brought up the fact that we all have a pacemaker. Now, you've heard about pacemaker and you think of surgery and an artificial pacemaker, but there's a natural pacemaker. The heart is a phenomenal organ, and that pacemaker is what keeps the pace, right? It makes the pace of your heart. so you have a normal rhythm to your heart. Now, the human body is so clever. If the vagus nerve is irritated and that heart rate goes too low, then the pacemaker goes, uh-oh, what's going on? There's not enough beats. Then other parts of the heart will stimulate beats, and these are not the normal way it should occur. So you're having heart palpitations, or what's called ectopic beats, extra beats. So that was pretty fascinating. So what have we talked about? We've talked about anatomical changes because the stomach's in spasm, and or you have a lot of GI inflammation and everything has gotten pushed up, and that's impinging upon the heart, which that's what our program does. It handles all that inflammation and irritation of the gut, and our physical part of the program deals with the positioning of the diaphragm, sort of resetting that as we get the inflammation of the gut down, and also doing various exercises and manipulation. Sounds a little odd, but there's modalities that are used to normalize vagus nerve function. None of this is drugs, none of this is surgery. These are natural modalities that can be used. That is part of our program, because our hiatal hernia syndrome program has an internal component with the gut and hormonal imbalance, if that's appropriate, as well as a physical aspect. And both of those really have to be done together to get a great success rate. So we've got the anatomy, we've got the vagus nerve function, and the last thing he brought up was drugs. And again, love this guy. He said a drug for the heart can affect the gut, and a drug for the gut can affect the heart. And I was like, oh, so great. But aspirin, we know a lot of people with heart conditions are put on aspirin. The research for that is not really strong anymore, so something you should look into if you're on a baby aspirin every day, which is unfortunately still common, because that can create a lot of inflammation in the gut. So there you go. Not great for the heart or the gut. And PPI. So definitely, if you're a subscriber to the channel, if you're not, consider it, and please share this with others. But I did a series kind of on PPIs recently, but what he brought up is the proton pump inhibitors, of course, just stop acid in your stomach. And the problem with that are well, you're just not absorbing because you don't have enough acid, but very specific to the heart, iron, B12, magnesium. These are some key minerals and vitamins that are so important for regular heart rhythm. Those are compromised because you can't absorb them anymore. And he said, even if you say, oh, I've heard B12 can help, or I've heard iron can help, or magnesium can help, he goes, it's not going to help if you're on a PPI. Again, brilliant and exactly correct. So, unfortunately, his viewpoint was just, well, get off the PPI and then take some magnesium and see if you feel better. Nothing wrong with that, except not root cause enough, right? So people are on these PPIs, and boy, they forget one dose and they're in such misery that they couldn't even go a few days. So that deeper root cause of why is that stomach in spasm, why is it being pushed up, why is it squirting its acid up your esophagus, those are the whys, those are the root causes that we get to naturally. Not difficult, actually. But again, if this is brand new for you, I wrote a whole book called Hiatal Hernia Syndrome, but there's a lot of other videos on my channel, and this is very, very key. I just loved hearing the cardiologist's viewpoint of someone who, and I say this all the time to patients, it's like, this is not opinion, this is anatomy. The heart's on the left, the stomach's on the left, there's not much distance between them. It only makes sense that as a hiatal hernia or hiatal hernia syndrome occurs, there would be, as Dr. Gupta said, pinching on the heart and actually changing location of the heart. So maybe I'm just geeking out and you won't find this as interesting, but hopefully you will. And at least it can explain, if you know somebody who keeps running to the emergency room or running to the cardiologist, that only goes so far in this country before they go, listen, you clearly have an anxiety problem. Here's your dangerous psychiatric medication as the answer. Meanwhile, what the person is experiencing is not only very, very real, but has an easy solution. So I hope this helped, and we'll talk soon.